48, and prostate cancer is nearly 100% survivable if it's detected early. September is Prostate Cancer Awareness Month. It's a chance to let men know the importance of early screening because 1 in 6 men will be diagnosed with the disease in their lifetime. So joining us live in studio this morning is Dr. Robert Miller from WellSpring Oncology. Thank you so much for joining us this morning. And this is a very important topic. And I guess the first thing is, what is a prostate and what does it do?
So the prostate is an organ that sits just below the bladder, and it's made to store semen or fluid that's involved with sexual functioning.
Okay, so what are the symptoms of prostate cancer?
Well, that's one of the things. There often are no symptoms, and at the time we want to diagnose men, we want them before they have urinary symptoms. But if a man has urinary frequency, pressure, is getting up a lot at night to urinate, he should at least be aware that his prostate may be at least be enlarged.
And for those who, if you have those symptoms, is it like that's hereditary? If you're, say, your grandfather suffered from that and your father, what are...
It does run in families, so if you have a family history, it almost doubles your risk. The important message I think we like to get across is 1 in 6 men will get prostate, and in African American is 1 in 5 men will get prostate cancer.
So ethnicity does have something to do with it?
Yeah, definitely. And also in African American men will get it younger. So we start recommending screening in African American men in their 40s, in Caucasians 45 to 50.
And how reliable are the screenings, Dr. Miller?
Well, the blood test, the PSA blood test, is usually quite reliable, quite sensitive. And they recommend even checking that as early as a man in his 30s and 40s to get a new baseline blood level.
And once you've been screened, if you're starting in your 30s and your 40s, how often should you be screened?
Well, if it's elevated or shows any elevation, then at least once a year. They say in your 30s and 40s you could get one baseline, but certainly if a man is 45 or 50, he should go in once a year.
And once you're getting those regular checkups, say, for example, the worst case scenario is that it is found that you have prostate cancer. And we are, in the introduction, we said it is 100% survivable if you detect it early. What are some of the treatments?
Well, that's what I think the big message now is, that you can have curative treatment for prostate and avoid surgery, avoid the risk of impotence and all the side effects that I think so scare patients off. We have some new revolutionary radiation techniques such as tomotherapy and CyberKnife that allow us to cure this cancer with virtually no side effects, no surgery, no very low, if any, risk of impotence. The very things that I think scare off men from even finding out if they have this.
Yeah, Dr. Robert Miller, thank you so much. And of course, we'll take your questions and pass them along to the doctor. You can send them to 10news@tampabase10.com or instant message me at GGTake3, and I will be sure and ask those questions here. You're watching 10 News This Morning. We're back after the break.